So as we're getting started, I do want to go quickly to our panelists and begin that conversation. But first, I'll let you all give some indication. If you had thought of something really important, put it in the chat. And what are the other instructions, Ginger?
Really, so the big thing we wanted to be put in the chat was what were the things that you were sort of hoping to overcome in your own organizations. Will and I were together and we had similar concerns. So our hope is that maybe there's like a theme that comes up that will help the panelists as we go through these things.
And so feel free to put your comments in the chat. And if you wouldn't mind, also go ahead and put in the chat which organization or church or congregation or anything. Put some of that information in the chat. And before we get started with our panel discussion, I wanted to share with you a little bit about who I am and the work that I do with the Living Water Association, and as a way of giving you all context of today's discussion. So I know there's only a few of us here, just a little bit more than 25 or so. But my role, I work as the Minister of Faith and Action for the Living Water Association. And the Living Water Association comprises of 150 congregations of the United Church of Christ all throughout Northeast Ohio. And as you heard earlier, when Reverend Dr. Elise Berry was sharing about the work at Chisholm and their resolution, part of one of my jobs is to take resolutions like that and then put them in front of the members of our congregations so that we can wrestle with this stuff together and find out what to do next. And my limited experience in this area helps me know, I think the most important thing we can do is listen to the people who are already doing this work and find out ways that we can use our resources to get behind them. And so my hope was today to not just hear about the resolution and to get a sense of what the United Church of Christ, where the direction that the United Church of Christ is going. And then also, as you know, Will Jones is here, the folks from the Akron Interfaith are here, different organizations are here, for all of us together to be part of this conversation. And so when we're done today, our conversation will be recorded, and I will put all of it together as part of our new community engagement toolbox, which will go live at our annual meeting on October the 30th. So I just want to give everybody the heads up. If you would like to see the conversation again today, have access to the PowerPoints, and be part of finding out what to do next about this, feel free to look at our website. It's going to be livingwaterone.org. And there you'll be able to find out lots of information. And I just put it in the chat so that you can see there. And also feel free to send me an email and let me know if you've got particular things that I can do to help with the ministry that you're doing or the organization that you're working with. And there's my email. All right, so now I want to go ahead and give us a chance to welcome our panelists. So I'm going to give you their bios here real quick, and then we'll move right into our conversation. So first, I'm just going to begin with Councilwoman Veronica Sims. So Veronica Sims was appointed to Summit County Council in January 2020. She has a master's in public administration from the University of Akron and is a former member of both the Akron City Council and the Akron Board of Education. Councilwoman Veronica Sims has a long record of fighting for the community that she knows well, from her work on the Summit County Developmental Disabilities Board, the Akron Summit Community Action Incorporated, and the county's efforts to address racism as a public health crisis, as we have heard. So just recently, Councilwoman Sims, she received the Liam Murray Award for Summit County Food Coalition for her lifetime of dedication to local food access. And that's really important, really important work, but also work that's really dear to the heart of that me and my organization and the stuff that we do. So she has a lifetime of dedication to local food access, and particularly in low income areas. So her experience in working to affect change for those who need it most makes her an invaluable member of the Summit County Council and a really invaluable member of conversations like this. All right, so I also want your, Veronica, Councilwoman Sims, would you like to say hello to everyone? She, as she just stepped away from her desk. Just.
So thanks for that bio. I'd like to borrow it too. So hello everyone. I just moved away because my mouse wasn't working correctly. I thought I was gonna have to go get one, but it looks like it's back too. So I just want to say thank you for the invitation to be here. I look forward to the conversation. As I mentioned before, my friend Ray got on the Zoom. You know, I'm always excited when I'm in a space with him as well as Sunny, because I not only come to impart, I also come to consume. And so again, I thank you for the invitation here today.
Thank you, Councilwoman Sims. So Reverend Raymond Greene Jr. is the founding executive director of the Freedom BLOC. The founding director of the Freedom ROC, field director of Black Fork Strategies, and has been working as an organizer and an electoral operative in Ohio for more than 15 years. He's founded grassroots organizations such as My Brother's Keeper, Northeast Ohio, that focused on training and supporting formerly incarcerated men. He served as a pastor in a local church and has worked as an organizer in the field staff for the Ohio Organizing Collaborative and Stand Up for Ohio. Reverend Raymond Greene, if you would, say hello to everyone.
Good afternoon. Pleasure to be here. Look forward to the discussion.
Thank you. I actually had more of his bio. I just did not realize it was a different paragraph. So I want to read this a little bit off also about Reverend Raymond Greene. In 2018, Ray led Black Fork's voter registration program that successfully registered over 140,000 voters and served as a deputy director for signature collection for issue 1 that successfully qualified for the ballot, and led the Get Out the Vote operation, which knocked on more than 350,000 doors. Reverend Ray Greene has held almost every position in an electoral program as a canvasser, a phone bank leader, directing local office, a regional director, and statewide program director. He has also worked on a variety of programs and developed Black Fork's popular education curriculum. Reverend Raymond Greene has also been deeply involved in local and statewide organizing around campaigns such as ending the school to prison pipeline, reforming housing policy in Akron, bail reform, and statewide policy to eliminate collateral sanctions for returning citizens. Reverend Raymond Greene is a graduate of Ohio Christian University, where he graduated with his associate's degree in pastoral studies and his bachelor's degree in substance abuse and mental health counseling. Welcome, Reverend Raymond Greene. All right, and now I give you an introduction to Kenyona Sunny Matthews. Sunny Matthews is affirming the humanity in all of us. That's her mantra. That's the mantra that Kenyona Sunny Matthews lives by and hopes to share with the world by spreading joy and love as an active community member. She graduated from the law school at University of Akron, and she's a mother, a writer, a public speaker that brings passion, light, and humility to her work. Ms. Matthews is a North Carolina transplant who's currently residing in Northeast Ohio with her significant other and 2 children. Welcome, Sunny, if you say hello to everyone.
Howdy.
All right. Well, panelists, welcome. Thank you so much for being willing to be on our discussion. And so Ginger Bakos and myself are going to lead in the conversation. If anyone has a question or a comment to make, we'd ask if you would put those in the chat. And my faithful moderator, Maren Keff, is going to keep an eye on the list in the chat at the bottom. So if you would just keep an eye there and leave information there, and we will make sure that we get your voice heard. So I'm going to start with the first question for Veronica and Ray and Sunny. So racism has been a public health challenge for generations. This is not new. How is the language of public health new? How is this moment, the language, any different than what we've done before? Have past efforts been influential in our declarations? And how has the understanding of public health changed the narrative around efforts to eradicate racism? And I'll let any of you choose to go first.
So I guess I can start. I've given some thoughts to this question. And I think that by correlating the impacts of racism on health conditions, on oppressed populations, has certainly added to the shift of how we talk about racism, and primarily because the way that it's been couched. But I think coupled with the clear and irrefutable health conditions of Black and Brown communities, really highlighted by COVID-19, helped significantly with helping people to really grab hold of what it is that we mean when we say racism as a public health crisis. Without question, the murder of George Floyd and the illumination of the many murders of Black men, unarmed Black men across this country, as well as intruders that come into their homes or places of safety and are murdered with little or no remedies of justice. And so I think with all those things coupled together, it enabled us to really couch the conversation differently. And I think that people found it easier to talk about heart attacks than they did to talk about race. They found it easier to talk about lack of access to vaccinations than to really talk about the issues and systems of race. So I think, I don't think for me as a Black woman, the conversation has really changed very much. I think how it's been shaped and fashioned has changed somewhat.
Yeah, and I agree with that. I think the way we have the conversation has changed. I think Black people have always known that it's a public health crisis, from the food that we eat to the lack of health care that we get when we go to the hospital or the doctors. I think this has always been prevalent in our lives, and we have always screamed that this is a public health crisis. Well, we didn't have the fancy words to call it a public health crisis, but we knew this was detrimental to our health. We knew that the way we got treated in schools, the way we got treated in all institutions that we walked into, based off of the color of our skin, contributed to the factors of suicide, death by heart attack, strokes, and all things like that. I think what has changed with this declaration is that white people can no longer walk around blind to the issue. Whether that changes the issue, it's still up for the debate, still up to be seen. But white folks can no longer walk around and say they didn't know. You can no longer blame Black people for the food they eat when there's no health food stores in our communities. You can no longer blame Black people for the food they eat when there's no living wage to ensure that we can afford to eat healthier. So I think the only thing that's really changed is that, in the eyes of white people, not necessarily their minds, but in the eyes of white people, you can no longer be blinded by the fact that there's discrepancies and disparities in the Black community that are made available and made by men, particularly white rich men, and then white women that allow for it to continue to happen.
I think they both covered it pretty quickly. I would just add a personal piece to that. I think for a lot of people, this declaration of a public health, of racism as a public health crisis will only lead to change if we actually do something. There have been different ways we've talked about racism over the years, and we always stop short in America of doing something. So if we just have these public health decrees and we don't move beyond that, hence the title of this, we won't actually be making change. So connecting what, Reverend Ray and Councilwoman Sims have said, I think that part of it is an awakening for white folks that there's a direct correlation between how we treat people of color and how they survive in this society. Connecting that, and then also adding this great, exciting, and new piece, you can do something about it. You can show up, you can show out, you can dedicate your time, space, energy, effort, and money, not only to making change for people of color, but also making change for yourself. Because I would argue that a lot of what we have going on in our society in terms of racism negatively impacts people of color, Black people in particular, but also white folks, because there are some inflated personalities that are loving themselves too much and then going out and killing folks. There are some ways in which racism has created, we're big, bad, and beautiful for some folks who are not big, bad, and beautiful. So if we solve these problems, I think for society as a whole, I think we would be in a much better space.
Yeah, and Mike, I might add too, I think, you know, the proverbial curtain was not only pulled back in this country, it was pulled back for the whole world to see. So it's hard for that genie really to get back in that bottle because it got broke when she busted out this time. And so like my brother Ray was saying, you can't not see it. And so it is, I think that too helped contribute to how the conversation is now couched and how people grasp it in terms of how in the world it really has implications on the overall health of Black and Brown communities.
And I want to take just a little step further with what Sunny was saying. It can not only be personal responsibility. We talk about personal responsibility. We talk about the boldness of white people in the streets now and the things that they're doing. But we also have to understand and look at and change the way that we create policy. Policy is the one thing that we can show how we believe that racism is a public health crisis. There's a piece of legislation in the city council right now that's going to show whether we believe that racism is a public health crisis or not. And that's what we got to look at. What policies are we creating since Veronica Sims declared racism a public health crisis? And I'm going to say since Veronica Sims declared public racism a health crisis, because there have been people in county council forever, and this hasn't happened until Veronica got into the seat. So I'm going to give her credit for this. But what does that look like from policies from here on out? And right now, the policies that I see coming out of city council does not attach itself to this piece of legislation that we got in county council. So not just the individual responsibility of the people on this call, but also your responsibility to call Mayor Horgan, call city council and say, that's not a policy that's equitable to what we discussed last year.
Yeah, I know. Howard, Mike, you're probably waiting to get in the next question, but let me say also this. I think that the shift is that because of all this happening all at once, we're no longer looking at caretakers, right? Before, we'd identify who's the caretaker of the system, who's the maintenance worker on this system. We got away from that. And we started looking deeper and bringing that to light, saying, no, this is a systems issue. So no matter if you move the caretaker, if the system is still in place, it's seamless. It just continues. So I think the issues of race got moved to obliterating system and not just moving parts and pieces around. And so that's the piece when my brother Ray talks about policy changes, we're talking about systemic policy changes. You know, there's this old cliche about, stop plucking the kids out of the river, right? Go downstream and find out who's throwing them in. That's the system, right? And stop placating, what racism is all about. Racism is not a dislike for, I liken it to, I don't really like the color orange, right? And so when you borrow my crayons, I take the orange out, right? So my friends don't get their color orange either. But that's just having a bias, right? But when you start lobbying Congress, right, to take orange out, no longer produce, you're talking a whole different ball game. That's what we're talking about here when we talk about racism.
It's such a really rich conversation. Thank you all so much for your questions, for your comments. And Ginger, you want to go to the second question for us?
Yep. So that's sort of the past, and then that kind of brings us up to the present. So, and this is a really vital question, so I'm glad that we're asking it. What work is currently underway or getting started that aims to tackle racism from the lens of public health? What is working? What is not working? Where is support needed to create holistic health within the African community? And I'm gonna lob it to Sunny just because I know that we've had some rich conversation about the fact that what happens a lot is that white-led organizations think they're suddenly reinventing the wheel when there are Black organizations who've been doing this work for a long time. So I'm going to lob it to her to start, and then of course Minister Greene or Councilwoman Sims, you're welcome to jump in.
All right. Yeah, we've definitely had this conversation before, and one thing I would like to say is I think where we are in our present is that we've got people like Councilwoman Sims who are fighting for us to actually enact policies that will affect change. But what Councilwoman Sims needs for us is for us to all show up, which is what Reverend Greene was saying. I also think where we are is there's got to be a way in which communities have to feel supported and leading their own change. So that's not folks coming in and acting upon them, but that is folks supporting the work they're already doing. So one of the ways in which I can talk about how we were there and then we couldn't cross it would be issue 1. We were there. We were making direct policy change. And for those who don't know, I will leave it to the masterful Ray Greene to explain specifically what that legislation was about. But it was groundbreaking in the way that it would reform the way we do criminal justice work. And as someone with a law degree who works in the court system, I can tell you it would have made a huge impact. But people couldn't see past what they thought it was doing. But something that organically came through communities of color to let that be. So there were all these groups that were created to say, no, that's not the way. There's another way to do this. No, we don't need issue 1. We don't, that's going to cause more harm. And to directly attack the work of the people of color who've been doing this and knew what they needed to do. Does that make sense? So I think one of the ways in which we can have change in the present is to be, number 1, transparent, number 2, supportive, and number 3, acknowledge. We always have to acknowledge and build off of where we came from. So I'll tell you a little bit about my history really quickly. I am from Greensboro, North Carolina. It was the birthplace of one of the sit-ins in the 1960s. And that is the last place we stopped. When it comes to racial work, that's where we stop, we live, we love, we grow, we share. But in 1979, the KKK shot up a housing project and killed 5 people. In the middle of the day, in a Black community specifically, they killed 5 people. And it was filmed and aired on TV. And all of the men who came, drove up, got out of their car, got in their trunk, pulled out guns and shot that whole community and killed 5 people. All of them got off. All of them were acquitted. Greensboro wasn't willing to deal with that history. Later in the 2000s, they started to deal with that history. And they started to do a truth and reconciliation project. Part of that work was acknowledging what we did, but also turning to the community and saying, how can we help you heal yourselves? What do you need from us? Let the answers come from within. And we support what you say. And that's not a bunch of people coming in and telling them what their needs. That's them developing and being supported by others. And I think when it comes to churches and religious organizations, that's where you should thrive and grow. Jesus was flipping tables. He was flipping tables for others. Wait a minute, this doesn't look right. We need to do that same work.
What needs to be done? The money needs to go to the people that's doing the work. What needs to be done? We need living wage, universal health care. We need equitable educational practices, equitable educational systems. Ohio, particularly Akron, is still funding the school system illegally. And then we need white people to get out the way. As Sunny said, now that this has been declared a public health crisis, white organizations doing diversity and inclusion trainings, white people are doing all these types of panels and discussions that has been done in the Black community forever. I got filing cabinets full of surveys. I got a survey out right now. There's history and history and history of what needs to be done in the Black community to make it equitable. The history and history and history of organizations fighting for funding to solve these issues to no avail. Right now we have $145 million this year coming in, $1 billion coming in this year from the federal government through the ARP, and then another 135 or 25 coming in next year. That is not going to make it to the Black community. A small portion that's going to make it to the Black community. And then white people are going to do what they choose, what they think that we need to make this city better. Right now, we're building $200,000 to $250,000 homes while people are in the projects are living in third world countries. What's not working is even though this has been declared a public health crisis, we are still doing the same thing that we was doing yesterday. But we need a total overhaul of how we think, how we allocate resources, how we get resources to those most affected, and how we don't give resources to the people that pay the most in student loans. Just because you got a $100,000, $200,000 student loan tag, don't make you the smartest person in the room. There are people with no degrees that understand what they need to make their community better. And we need to start listening to those people and providing those people with the leadership development and the resources that they need to make their communities better. We haven't changed the system. We haven't looked at alternative ways to run a system. We just declare public health, racism a public health crisis. That's all we've done.
Yeah, I think it's also helpful in this, if you're going to be in this work, this is what we understood. This is what I understand as an individual and also understand as a council person. If you're going to be in the work, this is not a personal affront. This is speaking truth to power, so we all have a shared understanding of what we're talking about. You know, the defense mechanism that says, you know, I don't have nothing to do with that. You know, that happened way back when. I find it quite odd because you wouldn't be dismissing inheritance from great grandpa saying you ain't have nothing to do with that. You accept it. You accept it as, you know, this is what you inherited, right? And so this is where we're at in America. And so this is what you've inherited. And this is what we've all inherited. So nobody gets to get a pass on this. And I said that the sooner we start understanding that, I think the more truer we can be about the work. As a county, we also understood the importance of taking an inward look in before we started reaching out to look at our systems. And, you know, some of the things surprised me quite a bit. You know, just the lack of data collection. You know, you collect data to give you some sense of the direction that you should go. There was data, but it wasn't the right kind of data. To talk about how we're training across the county, you know, looking at ways to consistently do that. So we have, again, a shared understanding of what some of the challenges are. And so that led to this past April, the expansion of that special review committee to include all of our charter office as well as folks in the community who could bring their own lived experiences to bear on the conversation. Now, as a county, we realize that we have some real limitations, but we also know that we are a great conduit for all of the municipalities and townships in our 31 beautiful communities. And so we understand our role oftentimes is going to be partnering to help leverage people in the work that they're doing. We understand that there are people who are just not at the same space on this journey. You know, some ain't even got on the roads yet, but some has been running this race a long time, tired, you know, sitting down a little bit, but they're still in the race, and we respect that. And so we know that, you know, so when the question, we're from now beyond the declarations, some people are beyond the declarations. And that is very frustrating. You know, I think they spend a lot of time, you know, in denial, or, you know, honestly, I think some people just pulled the shade over their head and said, hey, they've correlated the end to the pandemic to the end of racism, you know, so ridiculously so. But that won't go away. Again, I submit that the proverbial curtain has been pulled back for the whole nation to see. And so I'll be glad when we're on the other side of COVID-19 too. But the longer we stay in, I think the more illumination to the oppression of the systems that we need to really get at.
One question that came up is just asking for more information about the specific policies in Akron.
Any of you have?
There's
Yeah, go
no
ahead,
specific policies up right now. Well, actually, there's two policies up right now. One is right to counsel. People that go to eviction court normally are up against lawyers, and they don't have a right to a lawyer. And City Council has opportunity right now to pass a historic piece of legislation to ensure that everyone has right to counsel. Another very important legislation that's in right now is this $145 million that's coming up. The mayor has allocated $20 million towards violence. And now that he has convened these racial task force and things like this, and got some recommendations for violence programs, he has divvied up about $10 to $15 million to those people. But in doing that, he has created legislation for City Council to vote on that says that he gets the rest of the money. He gets the rest of the ARP money, no questions asked. And along with the money that's coming next year for ARP, he gets all that money to do what he wants to do with it, no questions asked, because he has a plan for the city. That's how politics have always been ran here, and it has not ever worked. For him to have an open checkbook with money that's supposed to go to directly impact the people, particularly Black people, particularly poor people, it's not right, and we need to fight against legislation like that. First of all, from the separation of power, mayor and city council should never correlate on any piece of legislation. That's not their job. City council job is to vet any policy that the mayor wants to get passed against, is it the best interest of the people? And this policy is not in best interest of the people. And for them to introduce it means that he already has the votes to win it, which continues to perpetuate racism inside of Akron. That money is not going to go to the organizations or to the community that most need it. It's going to go to continue to fund people and create opportunities for people that already have opportunities. That legislation needs to be stopped.
I will say I work for the courts, and I actually work for eviction court. So I'm very familiar with how the eviction process works. And I think it's always important to share actual like examples. So before without this legislation, the way it stands right now, many of these landlords are not only well-versed in what they need to do to get people evicted, they're also well-versed in how they can refuse rent, how they can dodge keeping apartment properties up to standard. They also have legal help. They're very familiar with the court systems and the people who are in those systems. So the way it stands now and the way we've always done evictions, they come to court, they've already got their ducks in a row. A pro se defendant forgot to file an answer. Automatic, you're out, you got to get out. The say person didn't know how to get on the Zoom link because now nobody's really coming to the court. That right there, judgment against them. And I think a lot of times what's happening is they don't even recognize that if there's a problem with their property, they can put their rent in escrow. So they show up. They do everything they're supposed to do. They have valid reason why this house is not safe for my family. So I didn't pay him until he was going to fix it. Completely valid. But they didn't go through the process in the way that they should. kicked out, and that eviction stays on your record. Now it's harder to get apartments in the future. With council automatically getting appointed, especially, then they will have somebody who can advise them through that process. And Akron is now starting to add mediations to our evictions. And I'm the one in charge of figuring out how we're going to do some of these mediations, right? Well, the purpose of mediations is the two people get in the room. Not necessarily they're going to agree to stay in the space that the person gets to stay. They're going to have a conversation. And it's supposed to be equitable power. Showing up to these mediations are lawyers and pro se defendants. And then the lawyers aren't able to make a decision that the person can, and there's all these nuances, right? But this specific legislation will increase people the amount of people who will be able to navigate this system. And addressing racism in the form of public health as a public health crisis allows us to put in place plans and ways of interaction that will provide people with ways to interact with oppressive systems. Because at the end of the day, this is an oppressive country, and all of our systems in some way oppress folk.
Thanks for this conversation. It's so rich. I'm not sure about everybody else, but I can even hear implications and things that I'm involved in. So I really appreciate a couple of comments that Reverend Greene made about how we use our money. You know, and people who are able to build $250,000 homes, and then there are neighborhoods that they can't even get the money to fix their windows, or fix their front porch. I'll
put a link in the chat. It's a lot deeper than that, Brother Michael. Yeah. I'll put a link in the chat. Y'all watch that YouTube video. We're talking about people living with rats. You don't get rats for being nasty. You get rats from bad infrastructure. Yeah. Like this is horrible.
Yeah, so thank you for that, and thanks for directing the conversation back to public health. And I don't know if everybody else can see through this, but the social determinants of health just bubble up to the surface here when we talk about housing, we talk about education, and so I appreciate all of this. I want to go ahead and move us to our last question, and give us about 10 minutes to wrestle with this question, and then we will work towards ending our time together. But our last question, so the first couple of questions were about the past and the present. So this one's really about taking us into the future. So here's the question: where do you see this public narrative taking us? The language of public health. Where else can we grow from here? What future opportunities does looking at racism from the lens of public health lead us, and does it leave anything out?
I think honestly, and I think that's the power of looking at public health looking at racism through a public health lens, is that health touches every sector of our society, right? And so it forces conversation in everybody's house, everybody's room, in the boardroom, courtroom, in the faith temples and in our houses of faith. And so I think we have to continue talking about it, because I think directly tied to that is the historic tragedies of racism and the current conditions that Black and Brown and poor communities find themselves in. And it really has a lot to do with, too, whose future we're listening to. Again, there's some folks out there who are talking loud, ain't saying nothing, really. But they're able to pull people into this division rather than trying to figure out how we unify. And since we're here with the church, I want to say, I love the Lord, right? And I really lean into him for his guidance. I think the church has to remember its power too. I mean, I'm in the marketplace, because that's where he sent me, was to the marketplace, and I enjoy being there. But I realize I don't war against flesh and blood. I think we have to remember that too. So there is a spiritual component that I think some of us, have gotten so far away from. We're trying to war this thing on our own. And so I'm just going to remind us that there is power in that. And don't leave that out no matter what you do. I don't enter a meeting without having, I try not to have had some conversation with the Lord before I go into that space. And that's just my truth. And speaking the truth, where we go in the future is going to depend upon us having the abilities to speak our truth and our willingness to listen to people's truth, whether it's different or not. But it also requires that we don't give you a pass, that you don't get to stay in this place. And just before we close, we have to begin to have conversations about how do we repair. We can talk about this all day, how sad that is, that should have never happened. But we have to enter the conversation of talking about reparations. Now, do I know what form that comes in? I really don't know, but I don't think there's anything off the table. It'd be different if we didn't have a history in this country of providing for reparations. This whole idea that we can just breathe and start from here is just a failed notion, because especially when you have generations of folks who have been behind for generations upon generations upon generations. You've got to level that playing field, not level it. You got to plow up the land and start to replant. But we have to do that in a more equitable way. You can't expect me to start 6 miles back and you almost at the finish line. We got to even that up. So we have to figure out, how do we have this conversation about reparations? I know people don't want to talk about cash payments, but how do we talk about it from every sector of our communities, from the church to education, to economic development, to housing, to our criminal justice system, the juvenile justice system, the whole 9 yards. We have to be willing to enter into that conversation if we're going to, really move forward. And that's scary for folks. That's even scary. This is my last mark, and I'm gonna step back and let somebody, and I would encourage my sisters and brothers, both Black and white, to refuse to talk about this issue from a minority standpoint. This is a Black issue plus minorities. It's not a Black issue, right? I shouldn't say that. Let me reverse. But I can't understand how the issues of racism became a minority conversation. We're afraid to even say Black, right? We're going to a room instead of address the issues that were really created. We can go back to 1619. I mean, we can start talking about racism in America, but we don't want to talk about Black. We rather talk about minority because it makes us more comfortable. And I think that's almost a front to Black communities. When we're not willing to say Black, when we're not willing to look at the circle of social determinants of health and see over, you can lay that from gun violence to cardiovascular, to diabetes, to lack of access to good healthful foods. You can lay that on top and you'll be in the same community, map after map after map, layer after layer after layer. So to not talk about Blacks, the issue of Black as a color, and just shoving it under a minority, although that makes everybody comfortable, lots of people are comfortable, it makes me uncomfortable. And it makes me feel like you still don't see me, despite of all the evidence of what is true. And so I leave that there. And thank you.
Yeah, for me, I think, go ahead, Sunny.
Just real quick, my mom's grandparents were sharecroppers. And if you don't think that impacted how we show up in the world now, you're wrong. Their parents were enslaved, and my mom actually met one of them. If you don't think that impacts how we show up in the world, you're wrong. Even closer than that, my mom's father was killed by the police in 1962. And if she was 2 years old, and if you don't think that has an impact on how I show up in the world today, you are wrong. Take all of that, take the fact that when the KKK shot up in the Klan shot up the housing projects in 1979, my dad was in a store getting a haircut in that community. If you don't think that has any bearing on how I show up in the world right now, you're wrong. Coupled with that, the $200,000 degrees that I have, because no one was able to help me pay for college. If you don't believe that that's a reflection of how all of that affected my family, you're wrong. Just like white people pass down wealth, people of color, in particular Black people, have passed down a lack of wealth. And that is not a reflection of them. That is a reflection of our society. And the only way we're going to undo it is by being honest. So for me, reparations are a baseline beginning, period. And I also think that when many white people, steer away from that conversation, part of it, especially church folk, if I can be honest with you, part of it is because if you're agreeing that a group or an entity should get reparations, then you are in fact agreeing that they have been wronged. And we are not ready to admit that. We are also clearly not ready to admit that we are continuing to wrong them. And so for me, reparations, truth and reconciliation, public health crisis, all of it has to come with some action. And that action has to be led by Black people. So I'll give you a perfect example. I think that the Sojourner Truth project that we heard about today, amazing. Amazing. But I was not comfortable when she was using language like she worked with women for us all. She was a Black woman thinking specifically about how to improve Black women, because we've improved the bottom of the barrel, everybody benefits. And I think I'll just leave it at this to say, I'm a law school graduate. I have 3 or 4 degrees, an author, all of this. And all of that is also influenced by the men who were shot in 1962, the sharecroppers, the formerly enslaved. So this isn't some, I don't like to leave spaces with making it seem like woe is me in terms of being a Black person, pride, heritage, and love. But I think that the way in which institutions of religion and white people in general can support people is to recognize, not only have you been harmed, we are still harming you. Tell me what you need me to do, how you need me to show up, and do the research so that you don't continuously cause negative harm upon them.
I wholeheartedly agree with Veronica and Sunny. I think we gotta have conversations. And when I say conversations, that means 2 people dialoguing, understanding each other, and coming to an understanding of anti-Black racism in America. I think we have, beyond George Floyd, we can no longer deny that there's anti-Black racism in America. We've seen escorts, friendly escorts, with housing stipends at the other end of the escort for our light-skinned refugees. We've seen whips and chains and horses for our dark-skinned refugees. This is clearly about anti-Black racism and capitalism. And we have to have a serious conversation about those 2 things, because those 2 things go hand in hand. And when we start having those conversations and we start building those relationships, what we also find out is that although racism is prevalent, and I experience it every day, that this is also about classism. This is also about throwaway people, Black people first, and then whoever else we could throw away next, normally women, and then white people, poor white people. But there's a trajectory that starts with Black people. And in order for things to change, we have to begin to have that dialogue about anti-Black racism, about the original settlers of this world, the original people of this land. We have to have that conversation, and then we have to create policies to put in place to allow for those people that have been directly harmed by the way America has done business to receive their reparations, to receive their hand up, to receive their land voucher, to receive their tax abatement, to receive their universal health care, or whatever else that we need to make my people whole. We need to do that. And then somebody put in the chat that we need to, I want to get it, we need to plow up the land and start to replant all together. And we can't, and it's easy to say that. And I think that's what we need to do. But you can't do that without having a conversation and providing reparations to the people you have continuously harmed in this country, for us to at least have that to replant on solid ground. But the conversation has to be had about the anti-Black racism that goes on in this country for years. The racism is so bad in this country that Germany studied our racism to form their racism, and they said we were too harsh. That's how deep this goes. When we are marching people into prison cells, marching people into low-income housing that doesn't have the amenities for them to take care of their family, allow them to feel safe, we have to have this conversation about the have and the have-nots. And then we have to have a conversation about the fact that we are created in a world for everyone to have a job, and we don't have enough jobs. And our biblical principles tell us that your talents will make a way, but we haven't created an economy that allows our talents to make a way, that allows us for us to feed our families without focusing and striving to be rich, because that's what this country has set at the bar, is to be rich. And once we have that conversation and understand that the reason why white people hold on to racism so tight is because actually what we're talking to them about without having this kind of dialogue is we're asking them to give up their jobs for Black people when there's not enough jobs in the first place. So we really need to have a conversation about the foundation of the country that we have created through an anti-Black racism lens that allows us to be the fodder for people to get rich or think they can get rich off of.
You know, when I think about something so simple, Mike, as, you know, the impacts of health, you know, just as a Black person, my sister Kathy, where's my Kathy? Wave your hand, Kathy. Kathy, wave your hand. So she was my partner in the chat. And, you know, we're just talking about the traumatization, the re-traumatization as we try to do this work and push against the brick. You know, we have to relive all this again, right? And part of that is, you know, going back and reclaiming the pieces that we were forced to give up in order to assimilate, to experience some semblance of success, right? And so when I think about something so simple as, you know, we passed legislation on the crown about the way Black folks can even wear their hair. When you think about, you know, not even as a professional, you know, I'm a master's level, have plenty experiences, lived and otherwise. But to think that I could not go in the workplace with a culturally relevant hairstyle, like an afro was out of the question. There was no pathway to advancement that way. Or you couldn't wear your hair in cornrows. I mean, talk about deprivation of personhood. And those who would dare defy the rules, you know, quite frankly, were denied opportunities. And so those impacted them economically, right? And so when you have poor economics, there's a direct correlation between poor health. And so as simple as that is, that's why when I say, when we talk about racism, it runs through every sector of society, and its impact on health is equally as present. So thank you.
This conversation has been extremely rich. And I think that all of us are walking away today with a lot of, a sense of how heavy this work is and how vital it is. Before we move on, I just want to say one quick thank you to all of our panelists for being here, for being part of this conversation, and giving us a sense of where we can go and what direction that we can make. So